The broadcast is now starting. All attendees are in listen-only mode.
Good morning. My name is Lance French. I'm the Business Development Manager for W&M Environmental, a division of Braun Intertech, and I'd like to welcome you to our webinar on Is Your Hospital Campus Up to Speed on RCRA Hazardous Waste Regulations? That's a mouthful. So our expert today is Braun Intertech's Daryl Oman. Daryl, thanks for joining us today.
Thank you.
Before we get started, I wanted to go over a few housekeeping items. If you have any questions, please send them through the GoToWebinar chat tab on your GoToWebinar window. If we don't get to your questions, I'll make sure Daryl sees them and we will get an answer to you as soon as possible. We are recording this webinar and it'll be available to rewatch on our website soon along with the slides, and I will send you an email with a link when they are made available. So let's get to it. So let's meet our expert. So Daryl has more than 30 years of consulting and risk management experience in the environmental health and safety field and has obtained his BS of mining engineering from Michigan MTU. Is that right?
Michigan Technological University, yes.
All right. So you want to take us through some of your experiences?
Sure. Thank you. And thanks for having me do this. I've been in the business and consulting for about 35 years or so, and have worked for a variety of engineering and consulting firms as well. In the hazardous waste or regulation, that area compliance for corporations such as refineries and railroads and all the folks that have been in that world forever. Over the last several years, I've been working in the hospital industry, which is kind of a unique business in terms of the how regulations apply to that industry. I'm also a member of the American Society for Healthcare Engineers or Engineering, and also the Healthcare Association for Healthcare Environment, which are professional associations that have groups that help manage hospitals and their compliance needs.
Excellent. We just found out that the screen wasn't showing, so now I think we're up to speed on. We were having a little technical difficulties as soon as we came up. So you live in Minnesota. So you came down from Minnesota. So you have four seasons. Is it nice?
I do.
Right now?
We do. It's we're our fall season was really kind of short, and we're kind of disappointed in that because it's usually pretty beautiful. So we're approaching winter pretty quickly here, and I just checked the weather and it's in the 40s. So,
oh boy!
Yeah.
All right. Well, maybe you're down here in Dallas, so now you can get a little break from the little 68-degree weather. So, okay. So let's get into. So these are some of the topics that are going to be covered. You want to take us through some of these?
Yeah. The primary discussion is hospitals and medical centers complying with hazardous waste regulations, and I know. Last month we had a discussion, or you had a webinar on hazardous waste regulations and kind of in general industry, and maybe Texas specifically. So we've kind of taken a little of that material, and we don't go into that great detail, but I thought I'd provide the audience sort of a brief history of how hazardous waste regulations came about, and probably dig into more of the applicability of those regulations to the hospital world and actually running facilities.
Okay, so these are the same regulations as everywhere else. Even though it's a hospital facility, the same rules apply to. So it's not, they don't have their own set of rules.
Right.
For
sure. Absolutely. They are, in as far as the government environmental agencies are concerned, they're a business just like everybody else. So the regulations came, years ago, and they've been applicable to that industry or hospital industry since the 70s. At least the hazardous waste regulations have been. It's a little hard mapping that regulation over onto the hospital world because of the nature of what they do. So again, more of the topics here, there are some recent federal regulations changes for hazardous waste that we will touch on those, and obviously they impact the hospital industry. And then we'll talk a little bit about sort of managing or developing, if you have a campus program, how to fine tune it and make it better, or if you're trying to develop it, or having some structural or some compliance issues, sort of some lessons learned.
Excellent.
First thing is more of sort of a definition or terminology, and actually most of this slide or parts of this slide is from a friend of mine who I've presented with in the past. She's a regional facilities director in Minneapolis, St. Paul for a system, and she used the terms "who's that," "what's that," and like other industries, I think healthcare is in hospitals are regulated by every alphabet soup of agency there is. But in the world of hazardous waste or hazardous materials and things like that, there's some key definitions that I think that are important. There's certainly acronym overload, but on the right are sort of like various agencies like OSHA, DOT, EPA, and things like that. But I think it's important to understand that the word hazardous has many different meanings in these regulations. And often if I'm with a system or some leadership team, there's some overlap or confusion or conflating of these terms and how they apply to their facility. So I think it's important to know, like, for example, OSHA is employee health and safety, occupational health and safety, and they define things like hazardous chemicals, which is a regulation people, employee right to know, safety data sheets and all that kind of thing. And then the U.S. Department of Transportation regulates the world of hazardous materials, because hazardous materials are defined as things that you put on a vehicle to ship across lines. The other thing is there's a new, this is quite new, but NIOSH has defined the world of what's called hazardous drugs, which chemotherapy agents in a hospital are defined as hazardous drugs according to NIOSH. And USP 797 and 800 are new standards that have been coming out that affect pharmacies and also the facilities in pharmacy facilities within hospitals. So there's a lot of activity on that. And then kind of the last one, the bullet here in blue is biohazard waste, which is kind of a catch-all for regulated medical waste. And the main part of this particular slide is that, all the items above the red here, we're not really going into great detail because those are really could be slides and webinars on their own.
Right.
What we're really talking about today is the bottom one, which is the definition of the word hazardous in a waste world.
Yeah. So I can see the confusion. I mean, you got hazard all over the place. And there's no variations of hazard, right? There's no adjective. There's like, oh, this is super duper hazard, or oh, this is not so hazard.
Right.
Hazardous hazard, right? So
I wish there was hazardous. I think we talked earlier, hazardous light.
Hazardous light. Yeah, this is hazardous light. This is, yeah.
So again, in the 2019, there's been a change in terms of and we'll go into this, defining what's the world of hazardous waste pharmaceuticals. So it's a whole another area, and that's immediately it impacts the hospitals because of the inpatient pharmacies that they run. So the next slide is just, again, we won't spend a lot of time on this, but kind of a few RCRA basics is the Resource Conservation and Recovery Act is known as the acronym RCRA or RCRA, and it was passed in the mid-1970s. And this is when other industries really started gearing up for it. So the refineries, the chemical plants, manufacturers, and all that, because they run large factories or complexes, and they have large volumes of various chemicals that they need to manage the waste right. There had been some amendments in the 80s, and then what's known as the Hazardous Waste Generator Improvements Rule came out in 2017. And then the one most recently in February of this year is the Management Standards for Hazardous Waste Pharmaceuticals, which is known as Subpart P. And so that's directly relevant to the hospital industry. In fact, both of them are, but they're still in stages of application. So that's sort of the hazardous waste kind of regulations and where it come from. What makes it, why is it so complicated for hospitals? Well, essentially they're complicated waste generators. And this is sort of some numbers that I've come across. I've been in small hospitals that are 25 bed, in rural cities, and I've been in 1,000-bed hospitals in New York City. So if I just take an average, let's say a 300-bed staffed hospital, this is sort of the universe of hazardous chemicals that they probably have on their campus or on hand or in use at any given time. Mm-hmm. So this is sort of the world of what are potential exposures, what are potential wastes that are generated. This is the world of the universe of the chemicals that they would have on, and there's certainly a bunch in the laboratory settings. In the pharmaceutical area, in terms of inpatient pharmacies, you could have 2,000 to 4,000, could be more. Some of those are chemotherapy agents, and which again are sometimes defined as hazardous drugs. Hazardous drugs is not the same definition as hazardous waste, which we'll go into in a little bit. And then kind of your facilities and imaging and sterile processing and a few other departments, there's kind of an oddball set of chemicals that are in use. The last thing on the bottom here is, I don't know if you're familiar, Lance, with the word universal waste, which is sort of the ubiquitous light bulbs or fluorescent light bulbs in batteries, and everybody generates those. So many years ago, the agency, the federal government, termed the word universal waste, which gives you some relaxed standards in terms of managing those wastes if you follow those regulations. Okay. If you don't follow universal waste regulations, you are then managing as hazardous regulations, and all your batteries and light bulbs would become hazardous waste, which is not what you want to do.
So I guess that's the key here is, if you don't know what's classified as hazardous, so it all starts with classification, because if you don't know what's classified as your hazardous waste, then you're not going to know what to do with it.
Yeah, and that's actually a part of the focus of, not only what we're talking about today is sort of the determination process of understanding, inventorying, identifying and inventorying your waste, and then doing waste determination so that you know which ones are hazardous waste. Gotcha. And there's many variations on that when you get into the state regulations, but we can't cover everything because we would be here for days, literally. Yeah. But that's, I think, a key part. In fact, the agencies, I think the federal government with their generator improvements rule has kind of honed in on that there was some weakness in the regulated community in terms of keeping their waste determinations and knowing what they're actually generating. So the next slide is, kind of like back to basics, is what is a RCRA generator? And I think of this as a building, a business, a campus. And so if we're using a hospital as an example, it's the whole place. It's everything that's underneath that roof, essentially. So it isn't just like lab is their own generator. It's the building is generating. If it's Memorial Hospital, and the Memorial Hospital lab is not a separate entity, it's all part of Memorial Hospital. The hospital is the generator. It's the physical property. What happens a lot in terms of the physical property is that if a facility closes and moves to another, moves their campus, let's say, and it's happened. I've helped hospitals with decommissioning of a hospital, and then they were building a new one. So their actual RCRA generator ID number at the old facility has to be closed, and there's a process for doing that, and you have to open up a new number at the new site with perhaps different waste streams, because maybe they didn't have all the lab there. Maybe have a central lab somewhere else.
Maybe they have a new lab.
Yeah, exactly. Yeah. So the key things for a generator, again, is the building, is the business, is, they have to identify and manage their waste properly. Key point on the bottom here is whose responsibility is it, or obligation or requirement to determine what their wastes are, and it's the generator. Excuse me, I'm going to take a...
Yeah, go
ahead. Because honestly, if you the generator ultimately is responsible for their own waste that they generate and what happens to them. So they have to take on the responsibility initially to identify them all and do the waste characterizations, the waste determinations, so that they know what they're managing. One other note I have too is it's pretty frequent that new chemicals and new wastes are generated or pop up in a hospital because a new chemical comes in, a new pharmaceutical comes in, lab decides to change something, or imaging decides to change from one product to another, and that essentially would create a trigger for a new waste stream or potential new waste stream, and that should be evaluated before so you know how to handle it, rather than things showing up on your lap and saying, well, why we didn't even know this existed.
And a lot of it is not only the management, but also mismanagement. I'm sure you've run into stuff where, hey, you've come across people that it's like, you know what, hey, when in doubt, it's hazardous.
Yeah, and there's kind of a double-edged sword on that, is that there's organizations that choose to overmanage or overclassify waste and maybe manage something that may or may not be RCRA hazardous because it's maybe simpler, and that could be a good thing. There's also things that are mismanaged that are certainly not hazardous waste, but are being put into the hazardous waste containers. Then your volumes are going up. It may trigger more compliance requirements. It may trigger you a different status, like a large quantity generator. You might need reporting, things like that. So you have to really be careful on how that. And honestly, it's a work in progress for most hospitals, and for pretty much any generator, is to keep checking on it, keep tight on that.
Great.
So the next one, again, we thought we would cover sort of the basics, and again, we'll have a couple slides on the generator improvements rule and the hazardous waste pharmaceutical subpart P. Key thing to note is that the relationship between the federal rules and the state rules. 48 states have their own, are delegated authorities, so they have their own hazardous waste program and compliance requirements. So the federal kind of lays out the overlay of what they want to accomplish across the whole country, and then states have a choice to adopt exactly what they have, and some do. Some make their regulations more strict, and many have. The states, in turn, can delegate down to another authority, and in fact, this happens a lot. Where I live in Minneapolis-St. Paul is pretty much all the counties in the metropolitan area of Minneapolis-St. Paul have their own hazardous waste inspectors. So you have to, typically, you're going to be dealing with a hazardous waste inspector or regulations from the county level, and you satisfy those. You then are, by doing that, you're going to meet the state requirements as well as the federal requirements.
What are the two that are not involved? Alaska and
Iowa do not have their own regulatory authority. So if, for example, in February of 2019, when the farmer rule came out, it immediately went into effect in Iowa and in Alaska.
Okay. So
quickly, a little summary on this, because we won't go into great detail. This came out in the 2017 in May, and there was some cleanup of the regulations that EPA wanted to do. There was thousands of comments on these. So there were some things in terms of like the second or first bullet underneath the key changes were perhaps a very small quantity generator in your organization or your business, like your corporation, could ship waste or transmit or transfer waste into your large quantity generator. So if you had a big campus somewhere or a big large quantity generator, you could do that. And so there's some bugs to work out within the Department of Transportation on that as well. They're in the second bullet there is addressing episodic generation, which is kind of it allows you to sort of have planned or unplanned events. If you, for example, had a spill of some kind of waste that created a lot of hazardous waste in that moment of time, that unplanned episodic generation event would not trigger you to the next level of compliance, like a large quantity generator. So those are good things. So this is still rolling out across the country. In fact, if you go to the next slide, it shows, this is courtesy of the US EPA. They keep a track of, in general, roughly what the status of the generator improvement rules are across the country. And right now, roughly about half the states have adopted it, and about half haven't acted on it yet. So bottom line, it's still important to kind of keep track of where you're at. And I mean, if you physically map where your location is on this map here, that's the rules you need to be aware of and comply with.
So in Iowa, for instance, so they have federal. They comply. They don't have their own own state federal regulations. So they
like for you have in Texas the TCEQ, right? And in Minnesota it's the MPCA. So we have our own state programs.
Right.
Iowa does not have a group like that.
So who's the inspector for Iowa?
The federal. It would be a
federal person.
Yes.
Coming in
It would be a region. I think it's region 6. I can't remember the regions. There's certain US EPA regions around the country. They're not always. I mean, inspections are pretty rare in Iowa.
Yeah, probably less frequent, and yeah. But when it comes, it's probably big.
They're probably there for a few days, I would say.
Okay.
All right. So then the next slide, we kind of started as a summary of the hazardous waste pharmaceutical rule. Again, this was published in February of this year. Key things are it actually defines what is termed hazardous waste pharmaceuticals. So there's definition of that. It describes how this regulation applies to what kind of facilities, like what is quote unquote a healthcare facility. And there's a lot of them in there. And a couple of things, again, remember the adoption is that this, the effective date was August 21st, which is just a few months ago, and it went into effect on Iowa and a few other states, because some states are they go into effect immediately. There's no legislative process at the state level that has to occur. But ultimately, this is probably going to take a few more years to filter through the whole regulated community. Another key thing, as I have underlined it here, is the RCRA hazardous waste pharmaceuticals. Those that actually qualify as federal RCRA hazardous waste pharmaceuticals are banned from sewering. So you can't discharge down a sink or a sewer of those. And that's generally a pretty small number of pharmaceuticals and probably shouldn't have been happening anyway. But that's something that went into effect immediately.
So I have a question. So we're talking about pharmaceutical rules. So we're talking about pharmacy. So is that any place that has a pharmacy, like, because, my grocery store has a pharmacy, Walmart has a pharmacy. So, and that's what we're talking about as well too?
Yeah, so going back to what the federal RCRA regulations apply, they apply to every business and every industry.
Mm-hmm.
So if you generate waste or generate pharmaceutical waste, this is going to apply to you.
Okay.
How this would be implemented across like a retail pharmacy or a chain or something probably is going to be different. It will be different than what you would want to do in a hospital, because hospital are inpatient pharmacies.
Mm-hmm.
In a retail setting, for example, you just drive up to the store and you buy, as a consumer, you buy what you want and you leave. You're now a consumer. The regulations for waste management leave the building with you.
Okay.
They don't apply to you. If that pharmacy, for example, on that corner has damaged goods or something they can't sell, they would have to follow these regulations.
So if I took my medicine from the drive-through, this is probably an extreme example, and I just took it and I just poured it straight down the sewer, they're not going to be responsible for it. I'm not. Maybe we shouldn't talk about that.
Yeah, I don't think I want to comment on that.
All right, but
You're a bad guy.
I know. Sorry. So, is there something that you have found hazardous that would surprise us, like in a pharmacy that that you're like, wow, we never knew that would have been a hazardous waste?
Well, okay. There's lots of examples, and I know we talked earlier about like sort of the blood thinning warfarin and things, but
Mm-hmm.
that's kind of like a high level one. Let's say there are some I can't remember when a person is on sort of a certain medication for digestion, things like that, it could have the medicine itself may not be hazardous, but there might be a preservative or some other component of that makes it hazardous. So even though from a medical standpoint you are prescribed this and you ingest it or you take it, the parts of that medicine may be hazardous. So if there's a waste produced or they couldn't administer it to you, that would be something that would have to be managed as a hazardous waste. So I can't think of head. There's literally thousands of kinds.
Yeah, I remember we wrote a blog about this a couple years back, and one of the things that's always surprised me was that there were certain cosmetics that you could sell, but if they had to throw them away, they have to be disposed of as hazardous waste. And
you're probably also, it might be some things that are part of the formula that would trigger it to be hazardous. And if we didn't go into great detail on the well, we will a little bit later about a determination, like is it a characteristic waste or is it a listed waste? So there's all those kind of variations there. I know. And this isn't really a pharmaceutical, but it's a common waste or common product in a hospital is the hand sanitizers. So they're ubiquitous. They're everywhere in a hospital, whether it's a foam or a gel or whatever kind of container they use or product they subscribe to. So hand sanitizers are infection control. They're very necessary in a hospital setting. But the containers expire, or the containers may get damaged, and the containers on the wall with half full, let's say half full. Well, then it becomes a waste because someone needs to decide, what do we do with this now? Is it something that we just toss in the garbage, or do we manage some other way? Well, if you go actually on I would bet any hand sanitizer safety data sheet, you're going to read that it's 60 to 70% isopropyl alcohol, which has a flash point maybe of 70 degrees. So just by looking at that information, it qualifies as a flammable hazardous waste, a D001. So the person who decides to throw that away is supposed to know that is a RCRA hazardous waste according to the characteristic of flammability, and we need to manage it that way. So that's a common.
Yeah. Certain aerosols too.
Aerosols fall in the same, there's normally or typically there's always some propellant left in it. And it's the propellant typically that is the hazard. So we make it flammable.
Very good.
So let's move on. We'll go on to the kind of the status of the hazardous waste pharmaceutical rule. Again, it's relatively new, came out in February, and everybody's sort of adapting it and reacting to it. But here you can see it's not quite all there yet. About 8 states have this in effect.
But that doesn't mean it's not coming soon, or we wouldn't know,
well,
or would like the TCQ is going to say, hey, we're going to be putting these regulations in place.
They will have to eventually.
Yeah. Okay.
It's just it doesn't mean you, say a hospital, could be proactive and change things? Yes, you could.
You probably should.
Well,
maybe.
No? You probably want to wait until it's actually adopted in your state. Okay. I think, because I've worked with some systems that are in multi-states. And so if they try to come up with, well, we have one policy that fits all. Well, it doesn't quite work in this world.
Wow. That can get confusing.
Yeah, I mean, most of the systems I work with are hospitals, they're kind of waiting for this to take effect before they make big changes, because it does change their practices. They may have to change containers, there may be reporting differences, training different. Yeah. So it takes a while to kind of let this to fit in. I thought since US EPA, I go to there a lot because they generated their own. This came through the federal government, and then there's various state variations. But this is quick links to if you want more information on questions about either of these rules, you can go to these links. You can find those. All right. So at the end of the day, Lance, why is it important? Well, there's a couple things, and I think the major one is the Superfund liability. People might be familiar with cradle to grave liability, which is the generator, again, the building, the business is ultimately in charge of the waste they generate and how it's disposed and everything in between. Mm-hmm. If there is an upset in that chain, for example, the waste is sent to an unpermitted facility or goes to a landfill without treatment, and there is perhaps 5 years from now some investigation for contamination that might have occurred in that, let's say a landfill or a dump or something. The agencies, the government, will track back and who brought waste to this facility or this location, and if your name is on it, you are potentially liable for the cleanup of that. So understanding where things are going and making sure that paper trail is accurate and tight and keeping it controlled is important.
Because you can do everything right up until the guys drive away.
Yeah. And there's, it
depends on what they do with it. Then,
right.
Yeah.
And in reality, the vendors who are serving the hospital industry are this all pinned down. Okay. If there's an upset, it's probably more horror stories from before. That being said, it doesn't preclude you from checking and auditing. In the industrial world, the refineries, the chemical plants, they're routinely auditing their vendors. They're going to their locations and saying, I want to see your permits for this. I want you to see your training, make sure your insurance is up to date, all this kind of stuff.
Yeah.
So understanding and kind of keeping that paper trail clean and tight is important. And there are some other kind of goals of why it's important, and kind of the bottom one here is the hospitals in general are surveyed and prodded and poked by a lot of different agencies, and the accreditation organizations are those that kind of come in and do surveys for compliance with Medicaid, Medicare services and things like that. And those always have the ubiquitous, are you complying with state, federal, and local regulations on things, and things include hazardous waste, and you have to demonstrate that you know what you're doing in that area. All right, so this is kind of the meat here. We've got a lot of stories on hazardous waste program management, and I sort of boiled it down into like 5 steps. If you are developing a program, or you're managing one, or you're trying to either improve it or amend it or something like that, you sort of have to have these 5 steps pinned down. And today we're more or less going to focus on the step one, which is identifying and evaluating all your waste streams. And the main thing here is that without a full and accurate completion of this step, this is a prerequisite for all the other compliance steps. You really won't know how to be compliant with all these other things unless you know what your wastes are and where they come from, what volumes and types they are, because all those have an impact on deciding what your generator status is. Mm-hmm. And once you kind of pin down the whole waste determination, your waste inventory, and then you figure that, okay, this applies to us, we generate X number of pounds per month of this waste stream and this waste stream from this department and that department, then you can get an estimation, or probably your best guess, of what generator status you are.
And we're not talking about biohazards or any of those other things.
No.
So can you?
This would be, so the bulk, most of the hazardous waste coming out of hospitals is probably pharmaceutical waste or lab waste, and maybe some facilities and a few other things. Mm-hmm. So there's unique things applied. I have one little story on this. As I was working with a hospital system in a Great Lakes state, and I was on the phone with their environmental services director and a risk manager from them. And for whatever reason, we were talking, and they thought they were regulated as a large quantity generator. And so I was asking questions like, well, can you give me some idea of your actual hazardous waste that you generate and some volumes? And they were giving me numbers. I'm going like, there's no way you're a large quantity hazardous waste generator. At the end of the day, I realized that they were considering regulated medical waste, the red bag and infectious waste and sharps, and the pounds that they generate of that per month. And that was qualifying them as a quote unquote large quantity generator of hazardous waste. And it was like, no way, that's a whole other area. That has nothing to do with the RCRA world.
And so that, probably saved them a lot of money, or.
Well, it was a learning point. Because I was trying to understand why they were even thinking about being a large, or why they thought they were. And after talking for quite a while, we just uncovered that they didn't differentiate medical waste volume from hazardous waste volume.
Okay.
And they thought medical waste volume was added to the hazardous waste volume. Therefore, you were over 2,200 pounds a month. And we're a large quantity generator. Well, it's a totally different regulation.
Yeah.
So you remember back at the first slide about putting that, we're not talking about biohazard waste. We want to set that aside.
Gotcha.
So a few things here again. Once you have your inventory complete, and I'll go into that a little bit later, coming up with your best guesstimate, or what you define as your generator status, then also sets your compliance requirements. And then kind of, this is sort of an observation or opinion of mine, because when I go into large hospitals or small hospitals, some are pretty good at this. In fact, it more or less depends on where your facility is located. As in Minneapolis, St. Paul, I mentioned where I live and work. A lot of the hospitals, in fact, most of them are inspected every year by hazardous waste inspectors. So everything's been pinned down. I've been to some locations where they've never had an inspection ever. They wouldn't even know what EPA stands for. So they probably don't have anything completed, or they don't have an accurate step number one done. And so that's really kind of a starting point. And then there's a whole bunch of other steps here, 2, 3, 4, and 5. But we could go into hours on each of these, because there are regulations and compliance requirements on each of these. But you really have to do number one first and get that going.
Excellent.
So this next slide is sort of I copied and pasted from Jennifer and Kyle's session last month, which I thought was a nice little. But this is really slide. Yeah, it's a little flow diagram. This is really kind of a simplification of it. So essentially, you have a waste. What is it? Well, is it lab waste? Is it pharmaceutical? What could be? And you go through this process to figure out whether it is a RCRA hazardous waste or not. And you do this for all your waste streams. And remember back to the number of thousands of potential waste streams they have? This is not easy. So this takes time and expertise.
The other thing too, and correct me if I'm wrong, and usually I am, but just because it's a solid waste doesn't mean it can't be liquid. Is that correct?
So, right. So solid waste is defined as liquid and gases as well. Yeah. So here's a good example is, and I think I have it on the next slide. hold on a second.
Sorry.
Many analytical or hospital lab instruments or analyzers are large machines. They like fill this room, right?
Mm-hmm.
And they have reagents, ingredients, and all kinds of things, products going into that they consume. And at the end of the pipe is it's hooked up to the sanitary sewer. Literally, I've seen them plumbed right into the drain, and it's running 24/7.
Yeah.
That is a liquid effluent that would qualify as solid waste under RCRA.
Okay. Yeah. So reading number one, is the material a solid waste? I would say no, it's liquid, so I'm good.
No,
but you gotta be careful about that.
Solid waste is defined as gas and liquid and solid in hazardous waste regulations.
Okay. I could go to another question, but I'm gonna skip it.
All right. Go back to that one more, please. The thing, what also remember, and this is kind of a theme throughout, is know if you have any regulatory changes or differences with your state regulations. So some states have more things that are identified as hazardous waste than the federal government identifies as hazardous waste. So you have to always think about that. Okay. This is an actual example, and I use it as an example of how to do a waste determination based on generator knowledge, which is, the generator is, in this case, is a lab, okay? And I put it, or lack thereof, or lack of a waste determination. So I did compliance, I would call auditing or assessment at this large regional hospital, and then spent hours in their lab. This facility and the lab itself too had never had a RCRA hazardous waste inspection ever. At that moment of me being there, they had never evaluated any of their lab waste. So this could be products that are bad, expired, effluents going down the sewer, you name it. So therefore, there's never been any hazardous waste generated, which is kind of cool because it, if you don't have any, you don't have to comply. Well, this particular analyzer had a cabinet, and the waste from one of its cleaners, because they have a cleaning process they have to go through. I don't know if it's daily or weekly, but when the cleaner is used, the waste of that cleaner falls into this container. It actually says waste container. I can't remember exactly the words, but it's in the unit itself. And when that container is full, I ask the technician, "What do you do?" And we disconnect it. We walk over to the sink and pour it down the drain, and then we reconnect it. And I go, okay. And I didn't know anything about this particular product or this analyzer at that moment. So I asked her questions. I go, well, do you have a user manual for this machine? And so I found it, and it was up on a shelf, and it's a 3-ring binder. And
blew the dust off of it.
Yeah, I did. And I flipped through, and I found like the waste part of it. And the little caption on the right there is a cropped from the user manual, and I underlined that in red ink at that moment. And if you read it, it says, spent isopropyl waste is considered RCRA flammable hazardous waste, and that's from the EPA world. That's a no-brainer, and it has to be managed according to this, and this. Okay, so I got that part, and then I said, well, what you use this cleaner? And I said, do you have a safety data sheet on it? And they say, yeah, we have one of those. So I found that, and I extracted this little section here on the bottom from the safety data sheet. The moral of the story is, it's clear that this needs to be managed as federal RCRA hazardous waste. It's
right
black
there.
and white. Yeah, it's a flash point of 60 degrees, which is way less than 140. It's isopropanol. I think it was 60 to 80% isopropyl alcohol. The difficulty is this facility had never had an inspection. I don't think the lab people understood anything about EPA or RCRA hazardous waste. No one had ever, and I don't
know what you don't know.
Right. And you and I talked earlier, they may have read that line up there and it didn't mean anything.
Yeah. Okay, great. RCRA.
Yeah.
What is that?
Yeah.
Okay,
so this is honestly, from a collection, training, and compliance, this is pretty easy.
Yeah. They probably said, well, let's not set this on fire, maybe.
Yeah.
But yeah. Well, so what triggered this visit, by the way?
This is a system in a Midwest hospital. I can't remember how many hospitals they have, maybe 5 to 7, maybe. And I went to their largest one. a executive director of EH&S, Environmental Health and Safety, came in from a Northeast states hospital system and was pretty familiar because I know I've worked in the New England area, and agencies and inspections are more frequent there. So this person came in, took this position, and then I think about a year or two later, he was scratching his head going, I think we need to have someone come in and kind of do an audit or check us out. So I did that, and I did a full report for this site, and then we had all the compliance findings, and the lab was, between him and I, we felt the lab was the highest risk because they were managing nothing, as far as they knew, right. So there was some extra steps, and it took probably 6 months to get everything tidied up.
Okay.
So this happened to be someone coming in that had expertise and knew the rules and regulations and saw that there was this gap in his own facility. All right, so if you think of that one process for that one waste stream, multiply that times another 1,000, right, for pharmaceuticals, and that hospital lab probably had 500 to 1,000 different chemicals. Wow. And that was just one of them. It's not something that's simple and fast. I mean, there's some assumptions and some groupings you can make, and some things that are common, and then there's some things that you really need to dig into and figure out. So if you go through that whole process, this is sort of getting to that step one and completing it, is you have evaluated all your waste streams. Then you have to decide what generator status you are, and you're going to fit one of these three categories more or less. And then, make sure, again, check on the state agency because they may have some variations, and I know some do. For example, in Maine, normally the federal government, if you're a large quantity generator of 2,200 pounds of hazardous waste a month, in Maine it's 220. They just factor of 10 lower. And so that's something you need to know. Okay. Let's say you, maybe there's folks in the audience here that have had inspections. I've been to facilities that have inspections. I've helped with inspection response actions, with the agencies. I've been into facilities where they want a mock inspection. You walk through because they've been told they're being inspected. So there's all kinds of variation on here, but in general, I would say the hospital industry for sure, it's been kind of off the radar of most agencies in some jurisdictions. They just haven't been, they don't think of them as a chemical waste generator. Yes, medical waste, yes, solid waste, yes, universal, but a chemical waste that has all these, hundreds, if not thousands of unique waste streams that have to be figured out. And there's some processes and firms that are good at doing that. There are some pharmaceutical waste companies that can take waste, and they have processes of kind of automating that process, and they're really good. So that's something you want to take advantage of. But then when you get into the labs or facilities, sometimes it's just one-off. It's just like you got to dig in and get the detail. So there's been inspections, and I've seen, because I probably have worked in about 30 different states, if I'm doing an audit or I help with a system or a hospital that had an inspection in a certain state, I'm going to find out exactly what the state is doing. What's the status of these new regulations? Are they in effect yet? Are they not? Do they have any unique requirements? And some states are pretty active and have really nice, helpful, useful information on protocols that they do for inspections, self-audit checklists, things like that. Even again, I live and work in Minneapolis, St. Paul, and the state of Minnesota worked with the counties, worked with the hospitals, probably 5 to 10 years ago, to come up with what they call a regulatory consensus on hospital or healthcare waste. So it's a laundry list of tackling all these unique things that hospitals generate, and how would we manage them as a group. So it was kind of a partnership, collaboration, I guess would be the best word. That doesn't always happen in some states. You just don't have the data on there. There's not the information as guidance, and you have to kind of do the best you can. One last thing on the bottom here is I've helped facilities and systems with what I call an EPA resume. It's kind of like a high-level data check. It's almost like doing a data audit of, I for example, if it's called Memorial Hospital in Dallas, Texas, right? I would research all the publicly information available from the state and the federal government on that location, and you couldn't believe the stuff I can find. So there's environmental information on waste generation, ID numbers, name of contact, all kinds of things, because there's a lot of information out there. What's important about this real resume is that it at least it's a really high level check as where are we at? Are we even close to what we should be?
It's and a lot of times you think of inspections, you think of, oh, they're going to find out stuff that I'm doing wrong, which I'm sure that, but there's also times where you can really help them out. I'm sure you found stuff that, because we kind of talked about some of the bio stuff that they were classifying as hazard. Has there ever been a case where you found that they were classifying hazardous waste that actually wasn't, they didn't need to?
Yeah, actually, I've done some work for this, I would call it a regional system in a Great Lakes state, and many times. I mean, I've helped them with inspections and stuff and other things, and actually pharmaceutical waste. And long story short, they have a large auditorium on their campus that they use for their own training. I've been in front of that podium many times. Or they farm it out to local groups. There's they have like programs there, plays and all kinds of things. It's really nice. It's a very beautiful facility. Once a year, the facilities department, engineering, has to do, I think they remove or replace the coolant that's in that building. And so they just go about that and they do that just like normal, right? Totally disconnected from the environmental world. It's just the facility does this. They hired a company to come in and extract all, and it was like 4,000 pounds or maybe 1,000 gallons or something of this coolant waste. The vendor that they hired recommended that they manage that as flammable hazardous waste, I think, or some kind of hazardous waste. And the facilities people didn't understand regulations or hazardous waste regulations, and they said, fine, sign the paperwork. Sure. Here it costs like whatever, $15,000 to dispose of it. Well, long story short, about 6 months later, the state government came in there and did an inspection, and they had data. They had the manifest from that disposal, and they asked the question to this facility, which at that time was a small quantity generator, it's a hospital, and said, you generated 4,000 pounds of this waste, RCRA hazardous waste, in this time period. You now should be regulated as a large quantity generator. And the facilities people are going like, well, wait, we didn't know anything. Yeah. So, maybe they did the right thing and managed it the right way, but it was when I got into there and I helped them, we actually classified the material as non-haz. So it's a waste. It's just not RCRA waste.
Right.
And it shouldn't have been on a hazardous waste manifest.
So that saved them. I mean, not only did dispose of it, but now they're not classified as large.
Right. And what unfortunately because they had triggered that back then, they had triggered that event to be a large quantity generator. Then they had to up their ante and game and do all the things that a large quantity generator, like write a contingency plan, do annual training. There's a lot of money and activity that caused.
Classify it right. Okay. We're getting close to time, so let's
all right.
We'll finish up these slides.
And again, this is a simple inspections. State and federal hazardous waste inspectors have protocols that they follow. So you could get if you get a federal inspection, generally they're a lot longer days, more detail. But this is sort of a detail. Essentially, they can go anywhere in a hospital, so they ask questions. And like most people in the inspection or the surveying business, if you go to one department and you get a lot of like crossed eyes and no one knows what they're talking about, they may start asking more questions. So that's kind of routine. But the one thing to understand here is that when accreditation organizations that come in and do the CMS audits or Joint Commission, they do not do these kind of inspections. Those are surveys. They're a totally different thing. The next slide this is sort of repeated from a lot of different presentations. Typical examples of violations or findings. Again, it all lines up to things that are pretty obvious. If the labels are wrong or the containers are open, all these kind of things are pretty easy findings. I've seen, I don't know how many I've noticed a violation letters I've seen and written or responded to. It's just, but these are pretty common.
Okay.
So the next one, I'm kind of going into some solutions. Like what would you do if you were just starting fresh, or if you've got something you're trying to organize, or you're trying to fix it, or you got responding to an inspection? You know, what are some things to consider? And again, the first bullet here is at a leadership level or at a system level, most people, in fact, even the risk management area of hospitals, EPA compliance isn't quite on their radar. It is when there's an inspection and there's not good findings, or they have some sort of incident like a spill or a release or something, and it triggers all that. Well, who's managing this? So it's not quite at the level of other things. And honestly, you know, the whole industry is dealing with all kinds of different things in terms of the regulatory world. So that's understandable. And I mentioned the Joint Commission as one of the organizations that does surveys from a compliance. They really don't touch on this. It's not something that's in their wheelhouse. So it's pretty superficial. And the last thing is kind of the hospital organizations. And if I go in and do an assessment, I spend quite a bit of time trying to pin down what each department actually does. You know, okay, we have a facilities department. Do they actually manage a universal waste program? Or an EVS or environmental services department, do they move containers of waste from one point A to point B? And I find out, no, it's the lab people that move from point A to point B. So this is all part of the program management you got to figure out. And as you get turnover or outsourcing, it's common, you know, it's relatively common that many of these departments are contracted to other parties. And so that adds a layer of, you know, it adds a layer of complexity when you're trying to get everybody walking in the same path. And on kind of the scale on the left here is sort of a depiction of all the kind of the basic waste streams, you know, buckets of waste. And then the red arrow is as you get higher into this, go up, it gets compliance requirements are more strict. Your fines, if you have an incident, things are going to be worse as you get up this ladder. And honestly, as I work with companies, and this applies to other industries as well, you do the best you can to put things in the right container for the right reason. It's never perfect, but you got to keep working on it.
Gotcha.
And then, you know, kind of a perspective from all the various departments I work with generally is you know, facilities and safety lab and pharmacy and clinical management, nurses, imaging, you name it. There's tons of them. In fact, go to the next slide because there's I want to give a shout out to my friend Ken Haber from Hackensack. He may be even on the call if he
Hackensack.
is. Yeah. So Ken is the director of the Network Health, Environmental Health and Safety for that system, which is I think 17 or 18 hospitals. It's very large. It's the largest thing in New Jersey. And so he and I presented in Baltimore at the ASHE National Conference in July. And so he used this slide as this is what he considers his stakeholders. So all of these kind of pieces have some impact or effect or role in managing a hazardous waste program in a hospital. So there's a lot of pieces. And in general, going back to that, remember that who's that, what's that? Mm-hmm. One of the symptoms or the outputs of that is that sometimes it's compartmentalized. Like pharmacy might be doing their own thing and they're not really connecting with lab. And I've seen that very often. Mm-hmm. No one is in charge as the group or the campus. So when Ken is in charge, you know, this is the kind of the group he tags and has input from. Wow. So that's real good. Go back to the previous one, please. So engage those people. You know, that's the group that you want. It's a lot, but you got to find leaders there, and you got to find people that have an appetite for this. Because this isn't something most people go to. I mean, I know that clinicians don't go to school for this.
Right.
Pharmacists don't. It's getting there, but it's not there yet. Mm-hmm. And then back to kind of lessons learned. Really do all you can to have a complete step one, because it really drives everything else. Because if you can't defend and verify that you generate these wastes, you really can't do the rest of it well. You're winging it at that point. Mm-hmm. And again, from my experience, and this doesn't just apply to hospitals. When I worked with refineries and manufacturing firms, especially companies that are going through acquisitions or mergers, and they're managing different people that are from different kind of cultures, mm-hmm. as much as you can centralize this, it helps with the risk management of it. You minimize upsets when you have some, it's kind of a top down to some degree. But until you start that way, the rest of it can kind of take care of itself. You got to start kind of at a leadership level. As well as centralizing the management is you want any kind of information that's generated in the program, like your manifests and notifications, training documentation, and inspection reports, especially the waste determination documentation. That is actually one of the key things that the federal government is trying to emphasize, is that, step number one is you have identified and you evaluated your waste. It's every NOV I've seen probably has that as a finding, because it's not complete and it's always a work in progress. You start somewhere and you get it 95% right, and then you deal with things that are new, basically. The last thing sort of is what can you do by yourself? You can, if you know this area and you can do this, you can do your own audits, self-auditing. You can hire a third party. I've done lots of these. So what kind of audit do you do? Do you do one that you would do for a refinery or for no, you have to tailor it to the hospital industry, because you got to call on those departments. And frequently it's, if I'm doing assessment of compliance in pharmacy, I'm using totally different language than I am in lab. Because they don't usually talk to each other.
Right. And I'm sure that people get nervous when they hear the word audit or inspection, because then they feel like you're going to have to report that to an authorizing agency. And so I'm sure there's a way that you can do it. I think we talked about, it's not an audit, but you call it a screen.
Yeah, there's the wording and I tend to avoid the word audit, because in the environmental auditing world, that is a defined thing. And the lawyers, the legal community, and the industrial community, like environmental from Amoco or BP Amoco or something, they know they have a defined protocol for an environmental audit, and they even have attorney-client privileged, or they have audit protocols that they follow. In general, that isn't a practice followed in the hospital industry. So you don't have a week to do an audit at a hospital. It just isn't the time for the staff to even give you that much time. So I've kind of cranked it down to sort of like an assessment or a screen, and perhaps there's not even anything written. Generally, we're not finding things that are going to be, immediate harm to life or environment. Like you would, like if you go to a factory and you see a pool of something on the ground, it's not going to find something. Are you going to find things like I found with the lab? Yes. Things that probably need to be managed differently, like right now. Is it going to explode, or is it going to, no, so.
Okay.
Yeah. So again, we're kind of wrapping up. I don't know if we have any questions yet, but essentially, I kind of wanted to give a brief sort of a regulatory history without going into a ton of detail, because it's really convoluted. But the applicability to RCRA to hospitals is really tough. I mean, it's like, trying to fit a square peg into a round hole. It's hard to do. And I covered a little bit about the regulation changes that are happening, and it's a function of where your state is on adopting those. The 2017 ones are about halfway through. States have acted or are moving in that direction, and then the pharma one we're still a few years out.
So we do have one question. How often would a hospital be inspected for hazardous waste?
Geez, I've been involved with some that are inspected yearly. So like I mentioned, Minneapolis, St. Paul, a local county inspector who is a hazardous waste inspector that would inspect other businesses comes to the hospital once a year, and they're there probably for a whole day. I would bet originally they were probably there for more than one day, but over time things have tightened up. People have responded. There's some facilities like I've been to that have never had an inspection ever. It'd be hard, and part of it is and I understand this is kind of human nature. Well, why would we do this if we're never going to be inspected?
Right.
And that's your choice as a business.
It's a gamble.
It is. The other thing too is about, let's say, number or chances of getting an inspection is, if you're a large quantity generator, are you going to be inspected more often and more frequently? And the answer is kind of yes and no. I mean, it's more or less a formula for, if I'm an inspector, Lance, if you worked for TCEQ and you were a hazardous waste inspector, it's probably as much work for you to inspect a small quantity generator as it is a large. Mm-hmm. But from what I understand, as far as the federal government is concerned, the state of Texas has to do a certain number of inspections a year.
Gotcha.
If I'm going to take work on, I'm going to probably go to the large ones because I'm going to have to do as much for a small, and I get more points for doing a large quantity generator inspection. So that's sort of, I don't know if that's common knowledge. It's just something I've heard, and I can understand that's a human factor.
Interesting.
The other thing about a large quantity generator is most states, and obviously you're required to do the biennial reporting every 2 years. So you're on the radar for that as well. And then many states require the large quantity generators to do an annual report. So you're more frequent. There's more frequent information on you when you're a large quantity generator out there that people can find.
Gotcha. All right. I think that wraps us up. Daryl, thanks for joining us, and great information, great webinar. I'm sure our audience loved it. If you wanted to get in touch with Daryl or have questions about your facility, or you want to do a, waste classification survey,
just call for questions.
Or just call for questions. There's his contact information as well. Thanks for joining us. And then, so our next month's webinar was stormwater compliance. We have Nick Foreman and Amanda Bergstrom from Minnesota too. We're getting these Minnesota people coming down, and they always want to come down in November, I guess. Not probably not in July. But thank you guys all for joining us. And if you have any questions, shoot us on the email or contact us on the phone. You guys have a great day. Thanks.